prostate, but I'm married to a man. I have friends and family that are men, and I'm always concerned about people and sharing information about prevention of prostate cancer, because if it's found early, a lot of times it is a lot more treatable than it's found when later. For those of you who don't know, I am a nurse, a registered nurse at Baptist Cancer Center, our Bartlett location, which is out at St. Francis Bartlett, which is kind of weird because we're Baptist. But I work with Dr. William K. Walsh. He's a hematologist and oncologist, and he's done that for about 20 or 25 years. So we are very knowledgeable about prostate cancer. Unfortunately, most of the men that I treat are men that are a lot more advanced than early stage. By the time you get to an oncologist or a cancer doctor, you're probably far off in the game, or your disease is more advanced. So today I get to share with you very briefly about prevention. Most of the time I'm teaching men about, okay, you have prostate cancer, this is what drug I'm treating you with, and this is what I need for you to look for. But today I get to talk about prevention. So just briefly, so age, any man can get prostate cancer. But the risk is greater after you're 50. So you always want to keep a good relationship with the doctor, go get checked. It's very controversial about the exams or what you get checked, but the PSA, or prostate-specific antigen test, is the blood test. There's also the digital rectal exam, which I'm pretty sure that most men don't want to think about. But it is one of the exams. But like I said, it's controversial as to which one, your risk factors and everything, as far as to which exam you will get. Race and ethnicity, which is also controversial. Cancer care is controversial all the time. It's always changing. The research is always changing. African American men and people of Caribbean ancestry are the men that they say can most have a higher risk of getting it. There are white men that get it. I treat all sorts of men with prostate cancer. It really has no color or race barrier. I want to say that for African American men, who I'm most linked to, I will say that a lot of men don't go get tested, or you don't go to the doctor. So that's dangerous in itself, because like I said, it's better if you get it treated earlier. I mean, it's kind of like a life or death situation here. So family history. A lot of men don't know this, but if you have a man in your family that has it, then you may have a greater risk of getting it. Also, if you have a woman in your family that has breast cancer, there are certain breast cancers that genetically can go along. We know with women, but for prostate cancer, that raises your risk for prostate cancer too. It's really a hormonal connection. Breast and prostate are two cancers that deal with hormones, so they are the hormonal connection there. There are some breast cancers, not some of them, but a lot of them. So remember that. Gene changes, I just talked about that. And here is one. I talked with Dr. Walsh for a minute about this. I told him what I was going to do, but diet. I can't stress enough that fruits, vegetables, white meat, stuff like that, just for any type of cancer. Obesity and weight have been linked a lot now. They are finding new research that's saying that a lot of that is linked to a lot of cancers. So you want to stay away from high-fat foods, processed foods. In moderation is fine. And then I read too, Lolita put some really good stuff in the bulletin. Calcium, dairy, you can do that in moderation. It's fine. It's just that moderation is good. But fruits and vegetables, things like that, I cannot stress enough that these are the things you want to be eating. Also, there's a couple of, let me back up a little bit. I mean, I assumed everybody probably knew where the prostate was, but some people may not. The prostate is a small gland. You can't see it on the outside. In men, that it's located below the bladder and above the rectum. So that's where it is. So that's why the exam is kind of intense. And it produces a fluid that helps to carry sperm during ejaculation. So it's there in the reproductive system, along with everything else down there that helps to reproduce. So some of the signs and symptoms. There are problems urinating is number one. Pain or burning during urination, or you're having to urinate more often, especially at night. Now, these are some signs and symptoms. Just because you have this symptom does not mean you have prostate cancer, okay? Blood in the urine or semen, trouble getting an erection, weakness or numbness in the legs or feet, or not being able to control the bladder or the bowel, which is like the tumor pressing against the spinal cord. But like I said, if you don't have control or something's happening with you need to go get checked out anyway. Pain in the hips, spine, ribs, or other areas caused by the cancer that is spread to the bones. Prostate cancer is a cancer, usually when it spreads, that's where it goes first, is the bones. It goes to the bones. I have men that have bad spinal compressions that we've had to rush to the hospital. I have men that can't walk right now because it's in there, the big femur bone. It does a lot to the bone. Let me see. Keep you out too long. So like I said, treatment, whenever you get treated for prostate cancer, I mean, you can do radiation, you can do pills, you can do chemotherapy, which is the most extreme thing. But hopefully, they have surgery too. Hopefully you don't have to do anything. They just watch a PSA. Like I said, by the time you get to me, you probably have your cancer's gotten pretty bad. I can think of vividly in my head now some men I've treated that are not here with me anymore. It is a very serious disease. I preach this because my men are the most hard-headed people.
Amen.
I got some hard-headed women now too, but as far as going to the doctor and prevention, I can't say that enough. Just prevention, and that's in the African-American community as well. I will say this, out on the internet, there's a lot of stuff. It could be your friend, it could be your worst enemy, but we usually go to American Cancer Society or the Mayo Clinic or the National Cancer Institute for information. My doctor is very research-based, so he would get up here and you probably go to sleep because he has all this, he's very research-driven, but that helps. Also, I have to have a disclaimer. I do not, and anything I've said is not a cure or diagnosis for prostate cancer. It is for informational purposes only. I am not a doctor. I am a registered nurse, but I am not a doctor. Get a good relationship with a doctor. And if you have any of these symptoms, some of this stuff that's going on, you might not have prostate cancer, but you might have something going on. So you need to get that checked out. Become familiar with your body. Like I said, eat right, treat your body good, and God has blessed doctors and researchers out here to come up with this information to help us all. And if you're a man, I say this, if you don't want to go to the doctor for you, think about the people you got to take care of. Think about your kids, think about your wives, think about your family. So that's all I have to say.
Thank you so much, Erica, for sharing that information with us. I want to share, I'm a survivor for 12 years now. I was diagnosed in 2011, and I'm still around doing things great. I got two